But if you're increasing access to suboptimal care or poor care, that really can be a detriment to people because most people don't know better. There's a lot on social media about if you have this symptom, it means you have this diagnosis, and of course, it's not
Mhm.
that simple. So there's a lot of misinformation, and when you combine easy access to misinformation with easy access to poor evaluation and treatment, then that's easily a recipe for disaster.
Hello, and welcome to the next episode of the How Are You Really podcast. Today's topic is Patients in Pixels, the perks and pitfalls of telepsychiatry. I am so excited about this topic because it's so important. During pandemic, we had to all go tele, and thereafter we've kind of stayed tele. So this is a good topic, and hopefully the discussion I've had with Dr. Susan Zink will be very helpful. I do want to introduce her. Dr. Zink brings 16 years of expertise as a board certified adult psychiatrist. She completed rigorous pre medical and medical education at Princeton and Georgetown, followed by a psychiatry residency training at UC San Diego. With special expertise in reproductive and integrative psychiatry, Dr. Zink is passionate about improving women's mental health and is deeply knowledgeable about traditional psychiatric medicine and research backed natural and complementary interventions. She adopted telemedicine into her practice almost 10 years ago and has been utilizing telemedicine since before it was made mainstream by the COVID-19 pandemic. She has a private practice in Linwood, New Jersey, where she helps adults and women in her community feel calmer, sleep better, and thrive. Her practice offers both in person and virtual options across New Jersey. Welcome, Dr. Susan Zink.
Hello, thank you for having me.
I am so excited to have you and talk about this important topic. I remember in my training, telepsychiatry was becoming a thing where, in adult residency, my program director was doing a little bit, and then during my child fellowship, I had an attending that was doing it. But then pandemic hit when I was my child fellowship, and telepsychiatry exploded, and it stuck around. I want to know, what do you think it is that has helped it stay?
That's such a good question. I think probably the biggest reason is the convenience and the reach. So, of course, once people realize they didn't have to leave their homes to get care, then I think that really makes it appealing for a lot of people. And then, of course, we can reach more people who, if they live in a rural place or they can't travel hours every day, can see a specialist that they may not have had access to before.
Mhm. Yeah. I want to get an idea from a psychiatrist's perspective. What has, been beneficial for you in having the availability of practicing telepsychiatry?
Sure, of course, there are benefits both to both sides, right? To the patient and the psychiatrist. So I've actually been using telepsychiatry since kind of before it was cool. It's probably been almost 10 years since I have started in the world of telepsychiatry. And for me, it was a lifestyle convenience choice. We moved around a lot because of family reasons, and I had a lot of little kids. And telepsychiatry allowed me to take my practice across state lines instead of having to start over again every few years. So that was how I initially got interested in it and decided to use it. And then, of course, when the pandemic hit, I was already kind of familiar with it. And that was really the only way that people were being seen via psychiatry in a lot of cases. And so for the psychiatrist, certainly there are a lot of benefits, job flexibility. You can continue to see people across state lines, assuming you have the licensures appropriately. And so you can build a lot of continuity
Mhm.
with telepsychiatry that you wouldn't necessarily be able to do if you were seeing everybody in person. I started I was working in a college clinic in person when I lived in Texas. And once the pandemic hit, we transitioned all of our students to telepsychiatry. And I actually still do that, even though now I live in New Jersey. I am able to continue to see those patients in
Mm.
Texas. And it's in a city in Texas, but it's in South Texas. It's a little bit more remote and they don't have access to a lot of psychiatrists there. So I'm still able to continue to serve those students and help out a community that may not have had access to it without telepsychiatry.
Very true. Do you think there is like a certain patient that benefits more from telepsychiatry and another that would benefit more for like from like an in-person care?
It's such an important question. I think there are definitely some like optimal use cases and then some cases where telepsychiatry really isn't appropriate. So, like I said, I think people who live far away, who are relatively high functioning and relatively stable, are really well served by telemedicine when they can check in with their psychiatrist and continue to take medications or continue to get treatment or continue to do therapy. That's really optimal for those kinds of patients. Sometimes I think it can be counter therapeutic. So if you have people who don't want to leave their houses because they have really bad panic disorder or really bad social anxiety,
Mhm.
telepsychiatry can almost be enabling of that and almost make it worse because part of the treatment of course is to get
Mhm.
out in public and slowly expose yourself to those things that make people really anxious. So in some cases that can be sort of a fine line, right? So if you can start somebody on treatment and maybe they get better enough that then they can leave the house and see somebody in person, that can sort of in a lot of cases be an ideal case. And then I think there are people who really are not good candidates for telepsychiatry.
Mhm.
Certainly, if there are people with really severe mental illness like psychotic disorders or active um, and challenging substance use disorders, those are really probably too high risk for good quality treatment, I would say, or I don't know if I should say good quality treatment, but I think a lot can be missed in those cases. And that, in my opinion, those are people who are really better served by in-person care and probably more wraparound care that involves more than just a psychiatrist too.
Yeah, and I'm thinking of a couple of patients. I have one that, I initially started with telepsychiatry, and when I finally went in person, actually, that patient lives very close to where my clinic is, but the anxiety is so severe that they have actually never made it in person to the clinic. And then there's another patient on the contrary, where actually today I have an afternoon clinic that's completely telehealth. This is my home office.
Right.
So they were having a lot of trouble kind of wrapping their head around that they won't be able to come in person to see me, even though they also have severe anxiety. So,
Hmm.
how do you feel about that? Like, certain patients are just like, I want that personal touch. Have you experienced that during, like, you've been, it sounds like 10 years of telepsych. So,
Hmm.
I know during the pandemic, everyone had to kind of be tele, but thereafter, were there patients that wanted to have that personal touch to it, in-person experience?
Oh yeah, absolutely. And I've seen it both ways. So I've done a lot of done telepsychiatry in a lot of different settings, and I've done some consult psychiatry. So I've seen patients in the hospital via computer screen, and they don't really have a choice. And so when the nurse rolls in the computer to talk to a patient in the hospital, I've had several patients say, I'm not talking to someone on a screen. I don't want to talk to you. Come in here in person. And so I think especially when people don't have a choice is when you hear it. But then there are people also who, if they are talking about the most sensitive and intimate details of their lives, would rather do that in person. And I can understand that. I think personally, I actually prefer to see people in person myself. I think that we all probably felt during the
Mhm,
pandemic that there was something really different about talking to people
mhm.
on a screen, something kind of intangible that we can't necessarily um, easily describe in words that when you're with someone in person, it feels really different than when you're with them on a screen. Although I'll also say that the studies show that telepsychiatry is just as effective as in-person care. So I think it's just really dependent on the person and on the psychiatrist, and sometimes even just a case by case basis, and maybe sometimes doing a mix of both.
Yeah, I think I have a lot of patients that it's kind of like that, where it's a mix where they'll come in person, but at times, even like that day, they'll be like, "Can I switch?" And I'm like,
Yeah,
"Sure." You
right.
know, another benefit, like if they can't make it, too much traffic or whatever, they can just get
Hmm.
online and see me. Also, I guess it has increased accessibility because, of course, before the pandemic hit, my attendings that were offering telepsychiatry were offering it in rural areas, like
Hmm.
it's rural Kentucky, and then I was in Florida, and it was rural Florida. People couldn't, travel to come to the
Hmm.
university, programs. However, there's those that just don't have a good internet connection.
Yeah,
How
right.
does that go? How do you deal with that that's happening?
That can be so irritating, right?
Yeah.
Yeah, I mean, I think, sure, we try to prep people ahead of time, especially if
Mhm.
you're doing outpatient psychiatry, that make sure you have a strong internet connection and be in a private space and sit still. Don't be driving, right? So we
Yes.
try to prep a lot of people, and sometimes I don't know, it just doesn't work out that way. And so I've definitely had cases where we've lost connection, and you spend most of the visit trying to reconnect. But I think what I've learned from those cases is that you don't spend the whole time trying to reconnect the appointment. Sometimes I'll even just call them on the phone and finish the appointment on the phone,
Really?
because if you're spending 20 minutes trying to make an internet connection work, that's just not going to work. You really obviously lose the value of the time that you're spending. So that can be very frustrating, though, for sure. Probably one of the most frustrating parts of
Yeah.
telemedicine.
Yeah, I've done the same where I've, ended up calling, or they'll, like, even initially just know that the internet connection is bad, and so they'll be like, "Can you just call me from the get."
Mhm. Mhm.
Which is, in private practice, that's kind of like the benefit that we can
Right.
do that, especially if it's a private pay direct
Right.
care practice.
Mhm. Right.
Um, what about, like, privacy concerns? You said that you tell them that they need to be in a private space, but
Mhm.
do they have concerns of where they're speaking from, or even, like, to the internet saying, "Oh, Zoom or another, software," they don't feel like their privacy will remain private, like, HIPAA
Mhm.
concerns. So how do you navigate that?
I feel like I'm more concerned about their privacy than they are in most cases. We, like you said, we try to tell them to be in a private space and to have confidentiality and make sure no one's going to come in or out. Don't be in public. But a lot of people don't worry about it, I think. I'm not a tech person, but certainly the technology that we've used, that's probably one of the benefits of COVID, is that a lot of these platforms like Zoom and Google Meet and all of these other video platforms have adapted to make their platforms HIPAA compliant and confidential. And so I think when people have a choice to do telemedicine, they feel reassured by that. Maybe I think in the cases where people are worried about the confidentiality are probably not the ones that are going to make the choice to see a psychiatrist via
Mhm.
telemedicine. And I've had patients where they didn't have a choice, again, where I saw them in the hospital and they didn't want to talk on camera because maybe they were paranoid that they were being recorded or that I wasn't who I said I was. And so those are cases where we might see some hesitance about talking to someone on screen.
Yeah. And how do you deal with when, the patient does have somebody in the room and they kind of are interfering with the appointment? The patient's okay with it, but you feel like the therapeutic part of it is being affected by it. How do you kind of navigate that from, a doctor, psychiatrist point of view?
That's such a good question. Partly I deal with it the same way that I would in person, and I will just say, why don't we talk alone for a minute? And then you can bring in your family member and we'll talk with your family member later on. So if you wouldn't mind stepping out for a minute, I'll just talk with so and so. by myself for a few minutes. I think the hard part is when you don't know when someone else is in the room. That's one of the difficulties or the challenges, I guess, of telemedicine is that you can't always tell if there's somebody else in the room, even though you may say you may prefer that there's nobody in the room other than the patient. You can't always tell. They could be behind the camera, they could be out of view. So I think that's maybe more challenging than just asking someone to leave.
Yeah. I've recently had this where, this is still a young patient. I started seeing them when they were a minor, but their boyfriend will be in the room,
Mhm.
and it's very interfering,
Mm.
because it just seems like the patient themselves is not, giving
Mhm.
what they want, more so what the boyfriend wants at that point. And not, like, necessarily that it's an abusive relationship, but, like, still, that's kinda controlling, and so,
Mhm.
like, it's difficult to navigate, definitely
Mhm.
for me.
Yes, I agree with you. It is. Yeah, one of the challenges.
Yeah. What do you think are other drawbacks to telepsychiatry?
Well, we talked about that sort of personal connection, that intangible personal connection that can sometimes be missed. Other things are that, of course, you can't do a physical exam. You can't touch the person that when they're on camera. So if you have a patient who might need a physical exam like the Ames test if they're on an antipsychotic medication, it's
Mhm,
hard to do that. It's impossible really to do the full exam when they're on camera. Interruptions when you're in a home office can certainly happen. Your dog's barking or your kid bursts into the room or they start like mowing your lawn outside the window, all things you can't really they're harder to control. And then also in more severe cases when you have a patient who might be in an emergency or in a crisis. I've had some cases where I was doing kind of direct to consumer, so to speak, where the patient was at home alone and I'm the one seeing them on camera and they're in crisis and I have to call the police or an emergency responder or a family member and you just kind of have to wait on camera until someone else arrives and that can be very nerve-wracking because
mhm,
there's nothing you can really do other than wait with them. You're maybe halfway across the country in some cases and you can't physically go to help them, so you have to wait for someone else who can physically go to help them. I think those are the biggest drawbacks, I would say.
yeah. What are your feelings about all the different telepsychiatry, larger organizations that are just it seems like almost like a pill mill, kinda
Mm.
situation. How do you feel about those, and how can that be limited, so that a good quality of care is still provided?
Yeah, I think if I had a really good answer to that question, I would be a billionaire, but there are pros and cons, of course, right? So increasing access to care can be really important, but if you're increasing access to suboptimal care or poor care, that really can be a detriment to people because most people don't know better. There's a lot on social media about if you have this symptom it means you have this diagnosis and of course it's not
Mhm,
that simple. So there's a lot of misinformation and when you combine easy access to misinformation with easy access to poor evaluation and treatment, then that's easily a recipe for disaster. I think some of the companies and platforms are certainly better than others, and some of them are really beneficial because they can recruit and hire really skilled psychiatrists who can do
mhm,
really good evaluations and provide really good care without having to set up their own practice, or maybe they're just not in a place in life where they can set up their own
mhm.
practice. So that allows them to do work and to give back their expertise in a meaningful and careful and thoughtful way. But of
Totally.
course, there are a lot of companies out there that almost feel like they're taking advantage of people who may just not know better about what is good care.
What do you think with, increasing access of telepsychiatry? What do you think the future is kind of gonna look like for psychiatry?
I think it's here to stay. I don't think
Mhm,
we are going to go back. I think we may find a different balance. I think we already have found a different balance. A lot of people, a lot of psychiatrists do a hybrid model where they
Mhm.
have in-person visits, and they also offer telepsychiatry because really it's convenient for people. I mean, I myself, as a patient or, for my own kids, do kind of a mix of both. Also, we have some specialists and pediatric specialists who are about an hour away, and once a year we'll go see them in person. And then the other times of the year, if we can do a virtual visit, we'll do a virtual visit. And that saves a lot of time, but we still have access to
Mhm.
expert specialist care. And so I think it's here to stay. And I hope that we just continue to improve it and continue to find ways to make it safe and
Mhm.
or at least as safe as possible, to provide some safeguards for people who may not be appropriate for it or who may be harmed by it and who don't know better.
Yeah, so, speaking of just telehealth in general, since you said, like, pediatric specialists, and so you for your own kids, you do some virtual visits. Do you feel like the quality of care is same or similar? Like, the time spent with patients, even telepsychiatry, is the same? And then in cases where physical exams may be needed, how do you feel about that?
I think it can be the same. I think that's probably really practitioner dependent. I think you really, like, as the clinician or as the physician, you really have to pay attention to what the potential sort of drawbacks or the potential holes can be in your care. And so you have to pay attention to how you're going to address that or mitigate that if you're doing a video visit.
Mhm.
Um, I mean, we've talked about some of the ways, but sometimes when you're seeing a patient, all you're really seeing is maybe their head and shoulders. And so you could be missing what's going on in the rest of their body or what's going on
Mhm.
around them in their space. And so I think you have to be really cognizant of that. Paying attention to your own facial expressions and your own body language is really different, I think, when you're on video. And I think that can actually be really tiring for a psychiatrist or a therapist or a clinician if they're on video all day. Personally, I found that pretty tiring. If you're on video
Mhm.
all day, and your patients are only seeing your face, and you have to really pay attention to your facial expressions, probably more so than you do in person, because they miss your whole body language when they're not in person with you. And so I think someone who's really cognizant of that or who is aware of that can maybe mitigate some of those issues. So it's case by case, I would say.
Mhm. So do you screen for what type of patient you're gonna take? I know you said that if they're more have paranoia or psychosis, that they're not quite a good fit for telepsychiatry, but what about other patients? Are you screening in some way? How are you bringing in patients that are just gonna be purely telepsych?
Yeah, I do that. In the outpatient setting, of course, you can screen. So in the college clinic that I work in, I'm the only psychiatrist, and then there are a group of therapists. So the therapist has always seen the student before they would refer. And I've been working with them for a while, so they know kind of what may or may not be appropriate. But then in some cases, they'll ask me, "Do you think this person is appropriate for a telemedicine visit, or should we refer them to someone locally in person?" And I think over the years, I've learned that people who are maybe more appropriate for a higher level of care, like maybe they're very, very depressed or they've had a recent suicide attempt. Certainly, if they're actively psychotic, I don't see a lot of that in the college setting, but if they're actively psychotic or using a lot of drugs and alcohol, then those are the people that I think I usually will refer to a higher level of care, and ideally in person.
That's a great point that you bring up because drug screening, urine drug screening and stuff
Hmm.
like that is difficult if you're doing only
Hmm.
telepsychiatry. Unless, the patient is completely honest with you about their
Right.
use, you're not really gonna know, if they're
Hmm.
using substances, yeah.
Yeah, one
You sorry, go ahead.
sorry, I was gonna say one thing I do in my private practice is I offer a phone call before setting up a new patient evaluation. And of course people can be not forthcoming during that phone call.
Mhm.
But also, I also set the expectation that if, after the first evaluation, if I think maybe I'm not the best fit for you, then I may refer you elsewhere. And that's always really an option, right? Even if we've seen each other a few times and I'm starting to think like, this isn't the best fit, then I try my best to refer someone to who would be a better fit or better able to treat what's going on.
So, have you had, someone ever get online and they seem intoxicated or anything like that? Has that happened?
Yes. Certainly. Not that often, but those cases are pretty memorable. I've had a couple of instances where someone seems intoxicated, um, or a case of a new patient evaluation, and maybe even the therapist has seen them a few times, but when I see them, it becomes apparent that they're psychotic. I've had a case where that's happened, and I had to call emergency responders and wait for the emergency responders to arrive. Nothing is foolproof. You can do your best, but of course, there are cases where things fall through the cracks, or people's behavior isn't predictable, so you do your best.
Yeah. What is your advice for psychiatrists or other practitioners when, a patient comes online and they just seem drunk or something like that? Like, they're not like high risk in any way, but they were just intoxicated. Like, what is
Yeah.
your recommendation what to do in that situation?
I think this is a really hard one because probably the textbook would say that you should end the visit. You're not supposed to
Mhm.
see someone who's intoxicated. I think I would address it with the patient. In reality, it's not that easy to do. Um, and of course, you worry about someone if they're alone
Mhm.
and they're intoxicated, and so just kind of abruptly ending the visit isn't always therapeutic or the in the best interest of the person. So, I mean, I would address it with them and I would probably ask them, like, you seem a little bit different today. You seem a little off, or ask what's going on. And I think it's important to kind of address it and to ask what's going on, that they are visibly intoxicated, and addressing that we're not going to have a very fruitful visit because you're in an altered state of consciousness right now,
Mhm.
and just reiterating the expectations and the boundaries and the appropriateness of how a doctor's visit should go. Certainly, I've seen people intoxicated in person too, so I don't think it's unique to telepsychiatry, but certainly easier for people, of course, if they don't have to go anywhere.
I've had a minor this was a long time ago where there were I guess they're raping and I have a lot of adults that will leave while
Oh
I'm,
yeah.
like, the
Hmm.
appointment, like, which, what do you say to them? Of course, in my office, I'm not gonna allow that, but what do you say to them over Telepsych,
Hmm.
But, with that being said, I know you have some funny stories from telehealth since you've been doing it for a really long time. I'm looking forward to hearing those.
Oh my gosh, yeah. Um, I mean, there are so many things that can happen. I mean, just like my dog bursting into the room, um, and he used to come up and kind of like sniff me, so you could see kind of his snout in the camera. This didn't happen to me, but a therapist I know who's been in practice for decades switched at the beginning of the pandemic, tried to switch from in person to doing teletherapy, and she at the time had two small kids at home, toddlers, I think, and this was the time when there was no daycare, no school, everybody was just stuck at home. And she told me she was in the middle of talking to one of her clients about something really, like a really terrible trauma that the client had been through, and just as this person was sharing this, her toddler burst into the room and said, "Mom, I have to poop." She was like, "Okay, I'm going to try to figure out how to go back to in person now."
And
Just
then
really bad timing.
I know, and as we were talking, it's so funny, and hopefully my mic is really good. My cat came in
Ugh,
just meowing,
yep.
at the top of how loud she could be.
Yeah.
As she's become older, she's become very demanding, so now she's sitting next to me quietly. She
Yep.
doesn't come on screen, but, she will be loud, and she'll push the door and try to get it
Yes.
open.
Yeah, absolutely. I've seen people's cats, like my patients' cats will kind of like prance across their keyboards, and that's cute though. I like seeing
Mhm.
patients' pets.
Yeah.
That's fine. I think it's more when you're the psychiatrist and your own pet is joining the visit, it's maybe, I don't know, makes me feel kind of awkward, but maybe
Yeah.
people don't mind it. I don't know.
Yeah. I'm guessing depends on how serious or what the conversation is, but I feel like pets always make people smile.
Yeah,
So,
definitely.
yeah. What about like frozen screens and, stuff like that? How has that been? Any funny stories from that?
Oh gosh, I can't think of a frozen screen funny story, thankfully. Probably. I think that's just more annoying,
Yeah.
really. Of course, screens freeze when your face is making the most unattractive expression.
Yeah.
That's probably a rule, right? Um, but I can't think of anything much funnier than that. It's just annoying.
Do you feel like when your dog was coming in and sniffing you, that in any way changed the dynamic between you and your patient, or did they notice? Like, how was that perceived?
That's a really good question. I can't remember if they noticed, and I probably felt so anxious about it that I probably couldn't even pay attention to what the patient was going through because I probably felt like it was unprofessional. That was probably like earlier in my time doing
Mhm.
telepsychiatry before COVID, because I think after COVID, once we all kind of accepted that a virtual world was possible, we all kind of got a glimpse into everyone else's life, and so I don't know that I would have, been so embarrassed or anxious about it if it happened during COVID, but probably before COVID, I don't even know I probably don't even know what the patient was thinking or doing because I was so focused on getting my dog out of there.
Yeah, yeah. I wonder if, like, it would help build rapport,
Right.
because people, like, enjoy pets, and
Yeah.
a couple of times I've had, like, my cat just hang out at the clinic in a different part, but if somebody sees her and they're not allergic, they get so excited. Just be like, "Can
Yeah.
I pet her?" And, like,
Yeah.
they get really excited, and that's mostly in person, and so I wonder if even online helps build rapport.
Yeah.
A couple of things that I've read other people commenting on, and I have more recently had this happen where patients will show up shirtless or
Yeah.
will pop up while they're in the bathroom and get
Mhm.
on. How do you navigate that?
Yeah. I actually can't recall a time when I have seen someone shirtless or in the bathroom, thankfully. I think if I did, I would say probably, "Hey, let me give you a minute to finish up and then why don't we reconnect when you're
Mhm,
done or after you've put your shirt on or
mhm.
after you've had some time to get dressed."
Yeah.
Um the one thing that I really mm, have set some pretty strong limits with is driving during the
Mhm,
appointment. It's just
mhm.
so dangerous. If I see someone driving, then I say, we're going to stop the appointment and we'll continue once you've pulled over and parked somewhere because it's just so dangerous to do. And so I can't even imagine if someone got into a car accident while they
Mhm.
were on a video visit. And of course, you're distracted, and it's not
Yeah,
probably the most productive visit if someone is driving. But
yeah,
that's where I draw a hard line. The other things are sort of like, hey, let's give you a little time to do what you need to do, and then we'll reconvene.
yeah. I feel like the boundaries have kinda become a little bit blurry with
Mhm.
more like, they would never show up shirtless in your clinic.
Exactly.
And the patient that this happened with
Mhm.
me is younger, college age, and I really didn't know what to say. They seemed
Mhm.
comfortable, and, you can't really see a lot, but you can
Right.
tell they're shirtless, so I'm just like, "Okay, I'm not even gonna comment. Let's just
Right.
do the appointment,"
Yeah. I
at
get
that
it.
point. So, I'm sure that if they have it set, a little bit further and they're shirtless, that would probably be more like, "Can you please put on a shirt and I'll wait for
Mhm.
you?"
Mhm.
But it puts the doctor in a little bit of an awkward situation.
So awkward.
Yeah.
Yeah. Right.
And then I had, this wasn't any of my patient, but another therapist was telling me that their one of their clients, was seeing a different therapist and transferred to them, and they transferred because their therapist comes online and is just eating and have, like,
Oh,
not
yeah.
even just, like, small something, but have, like, an actual big sandwich that they're just like, "Oh, I missed lunch," and they're just, like, eating in the patient's appointment, which, you know, is very inappropriate.
Yeah. Yeah.
Um,
Yeah.
I think if it's reverse, and I may have had that, I let them eat if they need to eat,
Yeah.
just because I feel like, they need their nutrition, and if, like,
Right.
that's the only time that they have to eat, then that's the only time they have to
Right.
eat.
Yeah, I agree. I think it's probably if someone came into the office, they probably wouldn't be eating a meal during the appointment. But I've had patients eat on screen before, and I guess it doesn't bother me that much unless I can't understand what they're saying because their mouth is full or something like that. But I don't think I've really had a case where I thought it was really a hindrance. Although, certainly, if your psychiatrist is eating on screen during your appointment, that is definitely unusual.
Yeah.
And I can see why that would be bothersome.
Yeah, no, I have put like, sometimes, like, if my throat gets scratchy, I'll put a mint in my mouth, and I
Mhm.
immediately have to tell the
Yeah.
patient that I have a mint in my mouth, but that's because
Yes.
you're not gonna be able to hear me if I don't because my
Right,
voice is
right, right.
getting
Yeah.
scratchy.
That's different,
But,
yeah.
mostly patients don't really care if you do, um, so it's I think a matter of rapport too, I feel like, but obviously
Definitely.
you don't wanna be eating, an entire sandwich.
Meal. Right. Yeah, yeah, yeah.
Yeah, so if you had the option to redesign telepsychiatry from scratch, you would do anything different?
Ooh, I'm sure there are things that I would make different. I mean, we've talked about some of them. I think some of them are hard to change, right? Like, because you can't control people's behavior. Ultimately, it comes down to people's behavior that how we respond to that is a little bit different sometimes when
Mhm.
you're doing telemedicine. I mean, if someone could invent a way where you could project a hologram into the room, that might be kind of interesting. And I say that jokingly, but I'm sure someone could do it. Maybe they're working on that already. That might be kind of interesting, and I wonder if that would feel different than just being kind of 2D on a screen to have someone who sort of feels like they're in person. That could be kind of an interesting way to reduce some of that sort of separation that we feel when we're on screen.
Yeah, and I'm thinking about one of the things that I didn't ask you earlier, but a therapist had once told me that they would sometimes do, and this is kind of like a little bit old school, that they would do home visits just to see
Mm,
like
mhm.
how their home life was set up. So have you ever asked a patient to show you around, or have they ever just kind of been like, oh, let me show you my new place or something like that? Has that happened? And what do you think would be the benefit?
Yeah, I think definitely do think there is benefit in seeing someone's home and the environment that they're usually living in.
Mhm, mhm,
It really can tell you a lot about them, about their family life, about how well they're functioning. So if you're seeing someone and they're kind of holed up in their bedroom because it's hard for them to get any privacy, that can be telling. I've had some cases where I've seen someone in person and then I saw them on video and their behavior was really different in their home, and I realized it gave me a lot of diagnostic clarity, I think, in that sense, because they were, like you said, this person I think was like vaping on screen, and the behavior was different than it was in the clinic, and it kind of really clicked for me at that point, sort of
mhm.
diagnostically what was going on. And then, yeah, you get to meet people's pets. Sometimes you meet their family members. And then I think I will say, which I haven't really touched on, is that telepsychiatry can be really helpful for the the postpartum period. I think too, especially when you have a new mom with a newborn. Leaving the house with your newborn can be so challenging, and I think that's a
Mhm,
case where offering telehealth can be really beneficial because
mhm,
those people may not seek care because it's so hard to leave the house. And those are cases where I think it can be really therapeutic because it's a limited time frame. And I think a lot of us who are moms understand how challenging it is to leave the house with a newborn. But you can also see how they're going back to talking about how it's beneficial to see someone in their home. You can see kind of how their, sleep situation is set up or how the crib looks or how the home looks and how they interact with their baby when they're at home. Women who are breastfeeding can maybe feel less anxious or more comfortable if they're at home. They can, breastfeed during an appointment at home and may not feel comfortable doing that if they're in a clinic.
mhm,
So
mhm, mhm,
those are cases where I think it can be really beneficial for both the psychiatrist and the patient
mhm,
to see someone from their home.
mhm. Yeah. Talking about postpartum, I had recently a patient that was just bedridden and they were
Mhm.
on
Yeah.
psychiatric medication and they were
Yeah.
able to see me via telepsych. I
Mhm.
thought that was really,
Yep.
beneficial for them.
Right.
I'm assuming that there are, primary care doctors that go, and there's home health for that. I haven't heard of home health for psychiatry per se,
Mhm.
therapist for sure. So that
Mhm.
was, I thought, really beneficial to the patient. And, I've had this situation come up and I had my reaction, and I'll share that. But I had a mom get on and just was like super anxious and distracted. And I was like, what's going on? And she was like,
Mhm.
my daughter just got bit by a wasp. They weren't sure if if she was going to have anaphylaxis or
Oh,
because they were
yeah.
bit before. So I told them, "Let's reschedule. You need
Yeah.
to go take care
Right.
of this."
Right.
How do you normally deal with that kind of situation as it comes up?
Yeah, the same way, I think if there's an emergency or something they need to attend to urgently, then I'll say, "Hey, let's reschedule," depending on your whatever your practice is. Like if it's in your private practice, I will say,
Mhm.
obviously there's no charge. Let's just reschedule
Mhm.
and have a time where you can really focus and you need to attend to that emergency. Of course, emergencies and urgent situations come up and they're not going to have a productive visit and they also need to go take care of this other urgent thing. So, I would probably handle it in just the same way.
Yeah. One of the things that I got COVID, of course, the new strain as soon as I think it came out. And that was the second time I ever got COVID, so I was just like, "Wow, like, how does this happen?" Like,
Yeah.
immediately. But, I was really sick. One day I had to cancel and reschedule, but I took the antiviral and felt better the second day, but of course I was still, probably infectious to others,
Mhm.
so I converted everyone to tele that
Mhm.
day
Mhm.
and was able to see them, and I feel like that's, helps,
Yeah.
even patients or
Right. Yep.
doctors, right? That, you
Yeah.
can still see your patient.
Right. Another big benefit, right? If you're too sick to go to the office in person, but not that sick that, you could still
Mhm,
work, I think that's a big benefit. Also, when
mhm,
there's bad weather,
mhm,
you can still you don't have to make people drive to your office, you don't have to drive to your own office, you can see them on telly or, certainly cases for me where I've had sick kids at home and I can still be at home, but the kids are home and, I don't I can see people via telly that way too, so it can be definitely it's a helpful tool in those cases.
yeah. So, if you had to had to name one biggest drawback of telepsychiatry, what would you say it is?
The biggest drawback, I think that will be different for depending on who you ask. I think for me personally, the biggest drawback is I do feel like if I do too much telepsychiatry, I lose that connection. I think it takes a lot more effort to build a connection when you're seeing somebody when you're doing kind of mostly telepsychiatry. For me personally, I don't think everybody feels like that. I don't think all psychiatrists feel like that. I think there are some
Mhm,
who love doing all telepsychiatry. Their patients love doing all telepsychiatry. So it's personal. I think the answer will be different depending on the person.
mhm,
Also, I
mhm,
find that I really have to project my voice when I'm talking on telepsychiatry. And there was a time I was during the pandemic, I was seeing so many patients in a day that I was losing my voice. So that's another big drawback for me.
mhm.
So that's my answer personally, but again, I think it will be different depending on who you ask.
Yeah. And, didn't ask you, but do you do a lot of therapy in your practice? And how do you feel like just med management versus therapy?
I do I think like all psychiatrists, I do some therapy, right? Like
Mhm.
if you have personally, I think if you're a psychiatrist, you have to do some therapy during
Mhm.
your appointments. And so I think it can go either way, right? Like I think it depends on the psychiatrist. I think it depends on the patient. I think I've done some really therapeutic work other than med management on screen. And it depends on the rapport you also have with that specific patient
Mhm.
and how comfortable they are with the screen and how comfortable you are with the patient. So like with most things, it's individual and case by case.
Yeah. Um, what would you, advise somebody now I'm gonna do it twofold. Patient-wise is,
Hmm.
considering starting telepsychiatry. and a psychiatrist, young psychiatrist, or even, an older psychiatrist that's about to start a telepsychiatry practice, what would be the advice that would give them?
For the psychiatrist, I would say be cognizant, be thoughtful of how you approach it. Use it to its most potential, to its most advantage, but recognize where there are drawbacks. And
Mhm,
how you might mitigate that, or if you have someone who may not be the best candidate, think about getting them to someone who may be a better fit, or to someone who may be able to treat them
mhm,
more appropriately. For a patient, I would say also recognize what the drawbacks could be. I think it's harder probably for a patient to recognize what the drawbacks might be. So I think you probably would have to find um, a psychiatrist or a therapist who really is thoughtful and can tell you whether this is the best modality for you as the patient.
yeah. All right, so I always like to ask before I end, how are you really doing?
Oh, that's such a good question. I am excited and I would say a mix of excitement and a little nervousness because I have a new practice. And so that's very exciting. And then, of course, there's a lot of uncertainty with starting a new practice.
Mhm,
Um, but it's mostly exciting. And I feel really energized about it. So I'm really looking forward to being able to serve my community. My practice is based in Linwood, New Jersey. And my specialty expertise, my focus is on women's mental health,
mhm,
helping women with hormonal mood changes, pregnancy, postpartum, perimenopause, anxiety, depression, sleep problems,
mhm.
helping them feel better and really not just feel better, but also thrive. So I am really excited to be able to share my knowledge, my expertise, and help people in my community.
Yeah. Thank you so much for coming on. I really appreciate your insight on telepsychiatry. I know you have a lot of experience from before, during, and after the pandemic. So, this has been really enlightening, and hopefully, psychiatrists and the community will benefit from all your insights.
Thank you so much for having me. This was really fun, and I agree with you.
Before we close, I always ask, how are you really doing? Thank you so much for spending this time with us on How Are You Really? If something in this episode spoke to you, send it to a friend, leave a review, or follow the show. It really helps. Until next time.